So in the cardiac system, today we are going to discuss about CHD. What is CHD? Congenital heart disease. So it is a clinical condition in which the structure of heart is affected. Okay, means the growth, structural growth of heart is affected. We already know that there is a hole in heart. Okay, always seen in the pictures, in the newspaper sometimes. So this is the actual name of the disease. Congenital heart disease means the growth of heart is not properly happen. Okay, the growth of heart is not happen properly. In that, what types of they are different types, but here I will discuss two things only. Okay, so what are the things which will cause these things, but there is a properly unknown reason. Okay, in that clinic, this is a condition in which after birth, baby have uh, difficulty in breathing. Okay, sometimes baby will unable to drink the milk, suck the milk. Okay, difficulty while sucking the milk. Okay, or sometimes she will vomit, baby will vomit, she or he. Okay, difficulty in breathing. Okay, or sometimes vomit, vomiting, or difficulty in while sucking the milk, difficulty difficulty in sucking the milk. Okay, or sometimes while crying, baby will become bluish color, kynosis, his hands, leg, and face, all you can see in bluish color. So these are the simple uh, simple symptoms or simple clinical things you can able to see. Why this happening? Because the heart unable to pump the blood to the body. Okay, so we know that this is the heart. Okay, we know there are the four chambers, valve. Okay, tricuspid valve. Okay, bicuspid valve, or we have pulmonary valve, we have aortic valve. So these are the valve which protect by entering the blood into the other channels or other chambers. So while contraction of atrium ventricles, it is right, left atrium, left ventricle. Okay. So while contraction, this blood will go forward. This blood will go forward from this wall to the lungs, from this wall to the aorta, to the body. It will not able to enter into the atria. Okay, this is because why this is not entering, because all the valves, all the chambers, all the muscles are growth are normal, everything is normal. So that's the reason the blood cannot be come into the another chamber. This is the normal function. If there is normal structure, the normal function will happen. So in congenital heart disease, what will happen? There are the number of issues. It may be the problem of valve, Okay, in any valve the problem will occur. Okay, and the second thing is that the problem of septa. This is the septa dividing the right and left. This is the septa dividing upper and lower. Atrial septa, ventricle septa valve. So defect of this septa is one of the reason. We'll call atrial septal defect. Okay, what we will call? We'll call atrial septal defect. Next is ventricular septal defect. It may be ventricle or atrial. So let's you can see the image. It is atria. So there is a wall between both atrium. There is a wall between both ventricle. So we'll call ventricle wall, ventricle septa, atrial wall, atrial septa. So this is a defect. You can see this blood is coming in this chamber. The blood which is pure oxygenated blood is coming in and mixing with deoxygenated blood. So this will cause the left atrium hypertrophy, and the blood will the more blood will come, the right side will increase the size. So the blood will deoxygenated blood will become more, oxygen blood will less. So there's the reason it will not reach to the whole body. Deoxygenated is more. So lungs need to more expand to enter the oxygen into the bloodstream. Then it will go to the left side of the heart, then to the body. So SOB will come. So during this process, what will happen? The as blood supply to the all organs decrease. Sometimes the baby will become unconscious also. Sometimes other problems will occur. Okay. So these need very clinical observation. Okay. Next, this is the thing you have to understand. Next condition is the most two important thing I am discussing here, not other things. What will happen next is we have patent ductus arteriosus. Patent ductus arteriosus. This is also a clinical condition. This is also a congenital heart disease. You will see this image. You can understand that this is normal heart. These are the uh, valves. Okay, these are the valves. You can see. Okay, this is the pulmonary artery. The pulmonary artery will send the blood to the lungs. So this is the aorta. So what will happen here? Breakdown of pulmonary artery, and some it will connect it to the aorta. So here blood will mix. Deoxygenated blood will mix with aorta. Aorta will sending the blood to the whole body. So here also some deoxygenated blood mixed to the body. Okay. So that's the reason the patient will have bluish color, difficulty in breathing, difficulty in uh, vomiting. Those are the symptoms you can see. So in the modern medicine, they will do the surgery. They will make the patch over here. Okay. Mostly the surgery will they will do after 3 to 4 years, or pediatric cardiologist will decide according to the whole, according to the disease, according to the size, according to the symptoms. Okay, they will patch up here this thing also, and this thing you can able to see. This will also they will do the patch here. Okay, then the blood will not mix from here to here. Okay, so this is the condition. If it is mild, mostly they will see in the okay, the diameter will see in So if it is normal, 1 mm, 2 mm, 3 mm, 4 mm. Actually, what will happen? The heart will begin because initially the baby will get the blood from the umbilical cord, okay, and it will supply to the whole body. So there is a no chance of deoxygenated blood. So here heart is beginning. It will on the growth stage. So it will start in begin minimum starting to 4 to 5 months. Initially, the heart will grow and its heartbeats can start. You can see that initial stage only heartbeats are, but complete growth you can see. Okay. So what will happen here? The our body in the baby in the baby the heart is pumping only oxygenated blood only. There is a no chance of deoxygenated blood. Okay. So everything the septa, the aorta, valve, tricuspid, bicuspid will place in time. Sometimes what will happen? It will not grow. Why? Because of the nutritional deficiency, due to the drugs, due to the any issues, due to the poor diet, due to the blood deficiency, due to the underlying diseases like diabetic, hypertension, or thyroid disorders, hypothyroidism mostly. If the mother have underlying diseases, what will happen? It will reduce the effect of growth. So that's the reason the baby will have these types of problems. Okay. So if it is 2 mm, 4 mm, the pediatric cardiologist will decide. But what I want to explain is less than 4, 5, 6 mm, maybe it will gradually like the growth will happen. The septa, the petendectus arterius will also able to patch up gradually. The baby will become healthy. Okay. In this condition, what type of treatment we will give is mostly A3. Okay. You have to give in mostly initially start with D5, but D4 is better option. Okay. According to the symptomatic also S11 you can give or S10 because metabolic remedy. Okay. Metabolism will increase by S10. So A3, S10. You have to give single remedy. Okay. Which will after sometimes you need out to give B or RE also. Okay. According to the condition. But initially S10, A3 will work on whole heart because you don't know because you have the any area there is a defect already. 2D echo will give the picture which examination you have to go 2D echo. 2D echo will give the picture of the heart where the hole is there, where the problem is there. Okay. Although you need to give A3 because whole heart is affected. Okay. So you need nutrition to the heart. Okay. So A3 is best and S10. What will it do? It will improve the metabolism, the effect of the medicine, not only effect of the medicine, effect of the uh, mother milk, environment, everything will improve, increase by giving S10. So we'll focus on initially S10 and A3. Later, if needed, we will add B or RE according to the condition. Okay. So this is all about congenital heart disease. Okay. If any doubts, kindly ask.